Hello, and welcome to our first webinar in our new webinar series, Reimagining Long-Term Care. Today's an exciting day, and I'm so happy that you could all join us. My name is Neil Dreimer, Director of the Health Innovations Programs at Healthcare Excellence Canada. My pronouns are he and him, and I'm so pleased to be your host today. HEC honors the traditional territories upon which our staff and partners live, work, and play. We recognize that the standard of living that we enjoy today is the result of the stewardship and sacrifices of the original inhabitants of these territories. We must commit to not repeat past mistakes and to work towards more equitable and respectful relationships with First Nations, Inuit, and Métis. Acknowledging the territories and the original stewards of these lands is a fundamental responsibility of our organization and part of our commitment to work towards truth and reconciliation. I also want to acknowledge that I am joining you from my home office in Ottawa, which is on the traditional and unceded and unsurrendered territory of the Algonquin people. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. I invite you to use the chat box to share who you are and where you're joining from. I also want to mention that we are pleased to offer French simultaneous interpretation for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. We invite you to share your questions and comments at any point during the webinar in either of our official languages. If you have a comment or a question, please add your question in the chat box. We will aim to address as many of the questions as we can during the Q&A session towards the end of the webinar. I also want to let you know that if you need any technical support during this webinar, you can reach out to our tech support team using the chat feature. This session is being recorded and will be available on our website in the next couple of days to review and share with colleagues who may have missed it. So I am so happy to introduce our esteemed speaker for today, Dr. Samir Sinha, who will be guiding us through an update on the new National Long-Term Care Services standards being released soon by the Health Standards Organization. I know Dr. Sinha is in many places, but if you're not familiar with him, he is the Director of Geriatrics at Sinai Health System and the University Health Network in Toronto, and a Professor of Medicine at the University of Toronto and Director of Health Policy Research at Toronto's Metropolitan University's National Institute on Aging. A Rhodes Scholar, Dr. Sinha is a highly regarded clinician and international expert in the care of older adults. He was recently appointed to serve as a member of the Government of Canada's National Seniors Council and is also, as you'll soon hear more about, leading the development of the new National Long-Term Care Standards for Canada. And again, just a reminder, please feel free to drop in any questions into the chat box throughout the presentation. So with that, Samir, over to you.
Thank you so much, Neil. It's a real honor to be here today and to dialogue with several folks who are really interested in the provision of long-term care across the country. I know many of you have been involved in the LTC Plus initiatives and now the new Reimagining Long-Term Care work. And I understand that Healthcare Excellence Canada has now worked with 2/3 of Canada's long-term care homes to really be on that journey together to improve the quality of care and the quality of work in our long-term care homes. And so we're hoping that our new National Long-Term Care Services Standard that HSO has been leading the development of for the last 23 months will be a further enabler in this journey that we're all on together. So I have a few slides that I'm going to present to really kind of give people an overview of what this journey has looked like, and then we'll have plenty of time for questions as well. So we'll go to the next slide. So the agenda for today is going to be introducing HSO as Health Standards Organization and the new National LTC Services Standard. I'll give you a little bit of an overview of how the standard itself has been developed and the work that's gone on, and then an overview of the actual standard itself, and then next steps for the standard, and then we'll have an opportunity, as I said, for questions and answers as well. So who is Health Standards Organization? Well, HSO develops standards, assessment programs, and other tools to improve the quality of health services in Canada and globally. Now, when we think about standards, I think prior to the development of these standards, I think a lot of people hadn't really thought so much about how standards are, that they exist really in every aspect of our lives. They are what we often call the invisible infrastructure, and they allow us to live and work safely and thrive. And so they can actually become the basis of government legislation, policy, regulations, and accreditation standards. So when we start thinking about standards, we start realizing that they exist all around us, but we may not actually see them at times. But this is kind of the work that HSO is involved in. So the development of HSO standards is seen by standard technical committees, and these standards also go through a public review process in which stakeholders and the public can provide feedback. And so Health Standards Organization is recognized by the Standards Council of Canada as a standards development organization. So if you want to develop standards and if you want to develop national standards, you have to be an accredited standards development organization. And HSO is the only one in Canada that exclusively develops standards around healthcare. And these standards are being used not only across Canada, but in dozens of countries and thousands of locations all around the world as well. We'll go to the next slide. So why did HSO develop a new national long-term care services standard? Well, as many of us are very aware, the COVID-19 pandemic really highlighted many of the gaps and needs that exist across Canada's long-term care home system. And so HSO was invited to submit a proposal to the Standards Council of Canada to develop a new national long-term care services standard to address the delivery of safe, reliable, and high-quality long-term care services. As we recall, back in 2020, during the first wave of the pandemic, there was a lot of talk and by our ministers of health and the Prime Minister about the need for new national standards. The throne speech in September of 2020 announced that the government would support the creation of standards. The Standards Council of Canada is an arm's length agency of the Government of Canada that oversees the development of standards. And so SCC put out this request for proposals, and SCC accepted the proposal and agreed to fund the development of a new standard for long-term care over 2021 to 2023. And so CSA also developed a complementary standard to address the design and operations and infection control, prevention and control practices in our long-term care homes. And that was released in December 2022. We'll go to the next slide. So the new standard, the new National Long-Term Care Services Standard, really, this is kind of in one statement what this is all about. HSO standard provides long-term care home teams, leaders, and governing bodies with criteria and guidelines for delivering resident-centered, high-quality care enabled by a healthy and competent workforce. We'll go to the next slide. So in terms of the overall milestones and timelines, so after the proposal was accepted by the Standards Council of Canada to develop these standards, HSO developed its technical committee in March of 2021. And with that process, once the committee was established, the next steps were to conduct a literature review to understand what the landscape was and what the latest literature was. And that really supported the technical committee to embark on standard drafting to help draft a new standard itself. By January to March of 2022, then in line with the Standards Council Canada process, HSO had to conduct a 60-day public review where we invited Canadians to help provide their input and feedback on the draft standard itself. That would then lead to a period of standard revisions where every comment received by HSO would have to actually be addressed in the finalization of the new standard, which is going to be published and fully announced early next week. We'll go to the next slide. So in terms of the development of the standards itself was informed really by the clinical and technical expertise and lived experience of our 32-member technical committee. It also benefited significantly from the input and feedback of over 18,800 Canadians, as well as the best available evidence. And I'll talk a little bit more about these three areas in the upcoming slides. So first of all, in terms of the development of the technical committee itself, HSO launched that call for applications for the technical committee in March 2021 and received over 250 applications. Really proud that the final 32-member technical committee included representation from 11 provinces and territories. And the SEC requires that if you're developing a national standard of Canada, the representation on technical committees has to be equally balanced between 4 different groups. So number one, we had a quarter of the membership being actual long-term care residents and essential care partners. The second group had to be members of the long-term care workforce, so folks who are frontline personal support workers, recreational therapists, nurses, and managers working in a long-term care setting. We then talk about leadership policy decision makers, for example, so those who may have more of a higher level governance level and experience within the long-term care sector. And then finally, a group of people with general interest and research and understanding around the long-term care space as well. So these 4 different groups were equally represented across our 32-member technical committee. And if you'd like to know, get to know who the members of the technical committee are, you can see the full listing and their experience at the link that you'll see in front of you. And so overall, it was that clinical and technical expertise and lived experience was really instrumental in the development of the new national standard. Unless it was really the committee itself that provided the direction for how HSO would work and engage with the public and how we wanted to get input and advice, the types of evidence reviews that would be conducted, and finally, the standard itself, overseeing all aspects of standard drafting, because the standard itself could not actually go out for public review or go out for final publication unless we actually had a consensus reached by the actual technical committee. So this is very much a citizen-led process that I had the privilege of chairing. We'll go to the next slide. In terms of the public engagement of the standard, that, as I said, we've had over 19,000 participants, or close to 19,000 participants participate through various levels of engagement. And if you're interested in hearing what we heard, if you will, we produced 3 what we heard reports. The first 2 are already on our website, and the third what we heard report will be published next week when we actually launch the full standard as well. And really, the What We Heard report number 1 summarized the findings from a national survey. And then the What We Heard report number 2 summarized the findings that we had from the second phase of public consultation work that built on further questions the technical committee had for Canadians around what we heard in that inaugural survey as well. And the goal is, with each of these What We Heard reports, you get to hear a summary of what we actually heard, and then being able to see how we've incorporated all of that feedback into the development of the standard itself. So the technical committee really relied on the feedback that Canadians gave and made sure that we want to share with everybody what we heard so that people could see how that was incorporated in Canada's new standard as well. We'll go to the next slide. So in terms of those public engagement pieces, I mentioned that inaugural survey that we did was from March to July, and we had over 16,000 responses. That then led to our second phase of consultation, where based on the responses we received, the technical committee then had further questions that we want to ask Canadians. And we did that through what we call consultation workbooks. So individuals or associations and groups could fill these out together. And these really helped us give more specific answers to questions. Like, people said they want to see more home-like settings in a long-term care home. And we're like, well, what do you mean by home-like? Everybody says that, but what do you mean? So this is where we want to get more of that nuanced detail that would help us better understand how the standard needed to be written itself. We'll go to the next slide. We also had what we call town halls. So this is where the technical committee wanted to get very specific feedback and input from different groups that need to really be represented, such as leaders and administrators in long-term care homes, family caregivers, residents, from the focus of equity, diversity, and inclusion, francophone individuals, people living in Quebec, our long-term care workforce, and Indigenous peoples as well. So those were quite helpful. And then, as I mentioned, we then went out for public review. So after the draft standard was created and the technical committee felt comfortable taking that out for public review, it was released for everybody's input. And we were thrilled to see the level of feedback we received. We received over 3,600 specific comments that came in from 582 individuals and groups. And again, that group could be a national association that had polled all their members and collated that feedback for us. And so I have to say that HSO has told me, as the chair, they've never had so much overall public engagement in a standard, and they've never had so many comments that have come back through a public review process. So this is unprecedented, the level of participation we've had in the development of a national standard. We'll go to the next slide. Okay, so then we also, during that public review process, we also then had 5 additional town halls where we specifically want to get further feedback around certain areas. The technical committee wanted more input to support the work that it was doing in drafting these sections that looked at engaging essential care partners, supporting the educational needs of the workforce, enabling palliative care, supporting governance and accountability, and enabling good communication. And finally, we had hundreds of long-term care residents who participated, either through resident councils or through some of our previous town halls as well. But we also wanted to make sure that we heard even more voices of frontline long-term care residents as well. And so what we engaged as a final engagement activity was we tried to target residents across the country, for example, from potentially underrepresented resident groups. And so we actually held virtual visits with long-term care residents, 63 additional long-term care residents who provided much more rich and detailed feedback that would really help us especially in our sections that focus really on resident-centered care and how we wanted to really make sure that we got the nuance and our writing as well as we could. So again, a huge amount of engagement, and we really appreciate the fact that Health Canada actually helped sponsor this public engagement work that we did. Without their support, we would not have been able to do such a deep and thoughtful level of engagement. So I would like to say thank you to them as well. We will go to the next slide. So I mentioned that we also did a lot of evidence reviews. So at the start of the development of the standard, HSO completed its own preliminary literature review to inform the drafting of the standard. We also had a previous version of the HSO long-term care standard that we could also look at and build upon as well. At the request of the technical committee, HSO commissioned 45 specific additional evidence reviews that were conducted by the National Institute on Aging. And this would help to ensure that the new national standard was based on the best available evidence as well. So some of the topics, we're not going to list all 45, included more evidence around staffing levels, occupational health and safety, safety practices, emergency and disaster preparedness, data collection, quality improvement, and many more areas. And those findings from the evidence reviews were instrumental in the development of the standard, particularly the guidelines that provide additional information to enable meeting each criterion that's laid out. We'll go to the next slide. So in terms of the new national standard, I want to really just give you some highlights and kind of some sneak peeks about what is going to be released next week. And for those of you following along, you'll find that a lot of this is very much in line with what you would have seen in the draft standard as well, because what we heard loud and clear from our public review was people liked how comprehensive the new standard being proposed was. They really liked the content that we had. But there was some more specific feedback on how we could tighten things up a little bit more, make things a bit more accessible, but really not losing kind of the premise of what some of you might have been very familiar with if you had looked over the draft standard we had. But essentially, we have 4 key areas that the standard really focuses on. So first of all, the standard itself is written at the level of a long-term care home. Some people say, is this a standard that tells the federal government what to do? Is this a standard that tells provinces and territories what to do? And no, this is actually a standard that's specifically been written at what an LTC home, its leadership team, and its workforce can do. So really, the standard is written at the level of a long-term care home, and therefore it provides guidance for long-term care home teams, their leaders and governing bodies, with guidance around how to provide evidence-informed, resident-centered care that values compassion, respect, dignity, trust, and a meaningful quality of life. Number 2, it's really focusing on working in a team-based way to deliver high-quality care that's culturally safe and trauma-informed to meet residents' goals, needs, and preferences. Number 3, there's a real strong emphasis on the workforce. So how do we enable a healthy and competent long-term care home workforce and healthy and safe working conditions? Because as we heard loud and clear from one of our key members, Dr. Pat Armstrong, that the conditions of work are the conditions of care. So how do we make sure that we are really focusing on thinking about those who are working in our long-term care homes, and how that really influences the resident care and resident quality of life? And finally, how do we actually help homes uphold strong governance practices and a culture that is outcome focused and committed to continuous learning and quality improvement? It's why many of you are here. Healthcare Excellence Canada has been doing tremendous work in its LTC Plus program, and now it's Reimagining Long-Term Care. That's really focused on thinking about continuous learning and quality improvement. And that's why we've been so lucky to partner as organizations between HSO and Healthcare Excellence Canada to really kind of enable this work. And I think why Healthcare Excellence Canada asked us to come as you embark on your journey as members of the Reimagining Long-Term Care Initiative. Go to the next slide. So in terms of the new standard itself, you may have been familiar with the previous draft of the standard, which had 10 sections overall. The new standard really, without losing any content, really helped to reduce the 10 sections to 6 overarching sections. So really, number 1, it focuses on that point of governance. How do we govern governing long-term care home strategies, activities, and outcomes? Number 2 focuses on what is essential to providing resident-centered care. Number 3 really focuses on the idea of enabling a meaningful quality of life. Number 4 is about ensuring a high quality and safe care. Number 5, again, is that focus on enabling a healthy and competent workforce. And then number 6 is around promoting quality improvement. So again, we've gone from 10 sections to 6 sections here, but these 6 sections really cover the real essence of what we heard was important to think about care at the level of a long-term care home. We'll go to the next slide. And we'll give some examples here about what you will be seeing in the final standard as well. So in each, when you look at an HSO standard, for example, it's written in a very deliberate way. Number one, you have the standard itself, you have its sections. So there are 6 sections. I believe there are 24 clauses. So under each section, there might be 1 or 2 clauses, which is an overarching statement. And then supporting in each of those clauses or themes under that section, then there are specific criteria that support that clause. And each criteria basically is a statement, for example. So it basically provides requirements based on evidence that describe what is needed by people to achieve a particular activity. So each criterion actually outlines the accountability. So who's responsible for this? What are they responsible for? What's the action? And what's the goal? What's the intent that we're trying to achieve? And then each of those criterion is supported by guidelines. And so this is where you'll find guidelines of around 200, 250 words, written really accessible language that provides additional information and evidence to really help provide some context, but also some guidance on what the best evidence suggests to support the implementation of that criterion. So we give 2 examples of criterion in the standard itself. So the first one is around the long-term care home leaders promote resident-centered participation in community activities. And then you'll see there's guidelines underneath that really kind of summarize the evidence and really give that rationale for how someone at the level of a long-term care home, whether you be a manager, whether you be a resident, whether you be a member of a family council, a family caregiver, or whether you be a staff member, you can look at this and then have an appreciation for what role you might be able to play in supporting the enabling of this criteria. The next example we give is from section 4. This is around care. And this really talks about the long-term care home workers, the long-term care home leaders facilitate residents' access to non-medical services. And again, give some guidance around how that can actually be achieved. So hopefully that gives you a sense of what you'll be expecting when you read through. And I believe we've got 6 sections, 111 criteria, and then supporting guidelines around that. And again, really preserving all the content you would have seen in the draft standard, but then also with 3,600 plus additional comments. There was the addition of some new ideas and thoughts, and then really kind of putting that together with clear guidance supporting each of the criterion that we have. We'll go to the next slide. So what are the next steps? So the standard itself will be released on January 31st, so next week, and early in the morning, and it will be available to the public at no fee for 5 years. So in order to access the standard, basically when it comes out, and I'm sure Healthcare Excellence Canada will be sharing news when the standard does come out, you can simply go to the HSO website. They have what they call the e-store, where you can look at all their different standards, but this is a particular standard where you can access the standard itself. You can print it out, you can share it, you can email it to friends, whatever you want to do. You can just once you get a copy of it, you can easily access it, you can print it out, you can mark it up, you can read it, you can do whatever you want with it, but it'll be out there at no fee access and downloadable for the next 5 years. The standard itself, in terms of what are the next steps with the standard, well, the standard itself is going to be included in Accreditation Canada's Cumentum accreditation program. So those of you who might be familiar with Accreditation Canada, they currently accredit 68% of Canada's long-term care homes. Against the existing HSO standard, they will now be moving towards accrediting all of their homes against the new this new standard that will be released. So we're excited about that because, for example, 100% of Quebec's homes are mandated, are legislated and mandated to actually accredit themselves using the Accreditation Canada standard, for example. And so soon, homes in Quebec, all homes in Quebec, will be using the new standard. And there are many, I think, pretty much in every province and territory, either the majority or all, or at least some homes are using this new standard. So it's great great and exciting, and it's very motivating for our technical committee to know that these standards are not just going to sit on a shelf, but they're already going to be actively implemented in a number of homes. And we're thrilled that working in partnership with Healthcare Excellence Canada, I think having already seen a draft of the standard like everybody else did, it's been thrilling to see Healthcare Excellence Canada saying this is really in line with the work that we're doing in our LTC Plus program and our Reimagining Long-Term Care. So with this standard being out and the standard already going to be in place in many of the homes that are working with Healthcare Excellence Canada, why don't we align efforts and really enable homes to be supported by organizations like Healthcare Excellence Canada on their quality improvement journeys, on their learning journeys, to further support their work in implementing the standard as well. So there are also other ways to implement the new standard. So not just through accreditation, but HSOs is working with all relevant stakeholders to determine the best and most impactful ways to improve the health and well-being of long-term care residents and workers across Canada. So another example is the Canadian Institutes of Health Information. If you're a home that may use the Inter-I long-term care assessment system, for example, you're often collecting an abundance of data that can support quality improvement efforts, everything from your use of restraints, for example, or antipsychotic prescribing, for example, a whole bunch of different things. And so what's really nice to see is CIHI early on, looked at our draft standard and said, wow, there's a lot of alignment here, that basically for all of the indicators that we have, or all the data points that the Inter-I assessments are already collecting and homes are already collecting, they align very well with a number of specific criteria. So as homes are looking to actually implement the standard themselves, the cool thing is that often you can go into your own portal on CIHI, look at your home's data as it relates to a specific criteria, and actually already have data you can use to support your quality improvement journey. So it's so exciting that we've been having conversations with CIHI to really help translate that, so that this is not a standard that sits in isolation, but you already have data that you can use and enable to support your quality improvement journey, as opposed to having to do new data collection efforts. And you've got a great organization like Healthcare Excellence Canada that's already working in the space of supporting quality improvement. And we're glad that they've been such great supporters of this work on developing this new standard as well, especially when so many homes will be implementing the standard through their accreditation processes as well. So we'll go to the next slide. So with that being said, I said that we'd have plenty of time for questions and answers. I think that we have a ton of things that have come through the chat, which I'm excited. So I'm going to pass, I believe, the baton back to Neil to help pepper me with as many questions as you can give me in the next until we have to pull the what is it? Until you give me the hook. We'll put it that way.
Thanks so much, Samir. And yeah, the questions are starting to roll in. But before we get there, I did want to just say thank you for not only for the presentation, but for the tremendous work that you and HSO have done behind the scenes to really support the level of engagement. I mean, it's amazing to see how much and how many people have really responded to the opportunity. And so kudos to you and to the team at HSO, and also appreciated the behind the scenes look at the development of the standards. But I know right now we have lots of questions, and just one other plug, and you mentioned it before we go to those, did want to say that as you mentioned, this aligns so well with HEC's new program, Reimagining Long-Term Care, which is really focused on enabling a healthy workforce to provide person-centered care. And then we're doing that in partnership with the BC Patient Safety Quality Council for BC homes. And really that's the opportunity there, is to support quality improvement in long-term care homes across the country, to really focus on fostering a healthy work environment to deliver safe, high-quality, person-centered care. So with that, I think let's go to the questions, and maybe I'll start and then we'll go to the many others that are coming in. And so I know there's a section specifically on resident-centered care, and we've heard, it's not unknown that we really need to shift away from task focused care to really on the needs of the residents. So can you talk a little bit about what we might see in the standard that might speak to that shift towards resident-centered care? I don't know if you could give an example for it.
Yeah, so I think the biggest complaint we've heard is that that a lot of care, not just in long-term care settings, but for those working in home care or even hospital settings, has really devolved into kind of more task-based care. Do this, do this, do this, do this to the person, get this done, for example. And it almost kind of can be dehumanizing for both kind of the resident themselves, but also the person trying to provide care, for example. So we really kind of take a step back. What the standard basically says very clearly is that homes need to be appropriately staffed. If you want to actually truly be engaging and being able to deliver the care that we speak to and how it needs to be provided, we need to make sure that homes are appropriately staffed, that staff are well supported and cared for themselves, and that we give staff the time and the space so that they can do a comprehensive assessment. For example, they have the time to reassess their resident needs, for example, that they can truly engage residents and or their substitute decision makers and the residents' kind of chosen essential care partners in developing a care plan and carrying out a care plan that doesn't just focus on meeting the residents' care needs, but also, creating a meaningful quality of life. So, and really some foundational aspects are making sure that care is culturally safe and appropriate, making sure that it's trauma informed, and also making sure that it's relational. That we talk about the importance of relationship-centered care or the importance of relational care in the provision of long-term care services. So I think when people do look at the standard and how you can read one section, but I think it's important to read it all as an entirety, and then you'll see how it all fits together, because focusing on one aspect without actually focusing on trying to deliver the type of care and the quality of life, and really putting residents at the center of what we're doing in long-term care homes really requires also well-staffed environments where staff are given the support, the education, training they need, and the appropriate governance to provide resident-centered care.
Great, and then that also covered another question I was going to ask about linking the making healthy and competent workforce to enable person-centered care. But I think let's go to some of the questions we received in the chat. So the first one, any idea of the timeline for Accreditation Canada to incorporate and start assessing based on the new standard? And what about other accreditation bodies like CARF?
Yeah, so I can't speak to CARF, but I know that Accreditation Canada, they use HSO standards as the basis for their accreditation programs, for example. So right now, of course, the standard literally, we had our vote, I believe, from our technical committee, our consensus vote, like days before the holiday break, if you will. And then once we got the go-ahead from the technical committee, it literally went into editing, translation, all these things. And I think there's still some final touches before it actually goes out to publication on the 31st. So it really is going to be a hot off the presses kind of piece. And then with that, what Accreditation Canada has told me is they certainly will be in contact with any of the homes they are working with currently, just to give them an understanding of timelines. I can certainly say that they are not going to be, as of February 1st, accrediting homes against the new standard. People need to see the standard first, as does Accreditation Canada, to actually look at what the standard says, develop their, and then further refine their accreditation programs towards that. So I believe that's a journey that probably will take months to potentially a year to support that transition to accrediting against the new standard, but they'll have more specific specific timelines that they can speak to as they look to that. The cool thing is when I talk to Accreditation Canada, their Cumentum accreditation program is apparently moving away from the once every 4 years accreditation cycle that has happened traditionally in long-term care homes to a continuous quality improvement kind of model, something that I know Healthcare Excellence Canada has been promoting for a long time, which allows homes to kind of see where they're at. And so, for example, the theme right now is around kind of a healthy and competent workforce to really enable that resident-centered care. Well, that's great. That's chapter, I believe that's chapter 5, and also chapter 4 and chapter 3. So that's kind of that. Those are those sections that, for example, homes that are seeing the new standard might say, great, we're already enabling kind of these sections of the standard in our continuous quality improvement journey with the help of Healthcare Excellence Canada. So I think people will see a lot more about that as the standard is released as well.
Thank you. So our next question is more talking about how, can you describe a little bit, maybe at a high level, the advancements or differences of the standard compared to the previous LTC standard? What's changed?
So I think a lot of things have significantly changed. So as I understand, the original HSO long-term care standard was developed between 2012 and 2014, and then it was actually revised between 2018 and 2020. And so the opportunity for us was to start with the basis of the previous standard, and then really kind of use the opportunity and early lessons learned from the pandemic to take a look at what else needs to be included here. And so what I think people will see as a fundamental change, from the previous standard is I don't think the previous standard really focused around governance at the level of a long-term care home to the extent that it does now. The real focus on that healthy and competent workforce, remembering that the conditions of work are the conditions of care, really bringing that out and giving prominence, a real strong focus on continuous quality improvement. And then really in terms of these areas around quality of life, quality care, really helping to spell that out. And what does that look like? What are the nuances there? Especially when we talk about resident rights and respecting residents' rights to live with risk, but then also thinking about the health and safety practices that we have. So when you look at the prior standard versus the new standard, I think you'll see a total sea change. But I think this is really because we've had the fortunate ability of 32 super dedicated and incredibly expert technical committee members who've really devoted hundreds, thousands of hours actually. We've had these evidence reviews and we've had the input of close to 19,000 Canadians as well. So I think really when you see the new standard, I'm quite proud, of what we've come up with because it really does reflect what we heard that Canadians said we want in our standard moving forward. And I think you will see something that resonates, that's reasonable, and really will be truly enabling for the care I think we all would like to receive, but also would like to provide as well.
Thank you. So our next question, I think you alluded to it a little bit before, but do the standards address caregiver to resident ratio? And can you speak a little bit more to that, or anything else you can share around that?
Yeah, so Section 5 is where we talk about the workforce, for example, and creating a healthy and competent workforce. And so we do talk about staffing levels we talk about staffing ratios, and we talk about staffing mix, because these are three different kind of areas that our technical committee really felt that we needed to kind of be more deliberate around and give more specific guidance around. So when we talk about staffing levels, for example, right now we know that various jurisdictions, we have a few jurisdictions in Canada, Ontario, Nova Scotia, and I forget where in Western Canada, have already announced that they're moving towards providing 4 hours of direct care per day per resident, and trying to do that over the next few years, for example, which is great. But the question is, we know some of the literature out there suggests that certain residents need more than 4 hours of direct care per day, and other residents may need less, for example, as well. So the latest evidence that we have suggests that 4.1 hours a day is the recommended kind of level of staffing, and so we note that, for example, in our guidance. But what we really emphasize, though, is that we can't really speak to all homes and treat them all the same. Homes need to understand who their residents are, what their needs are, and then understand what the appropriate staffing level is and be able to justify that. And then when it comes to things like staffing ratio and staffing mix, for example, or ratios and mix, we have to remember that what we heard loud and clear is that there are some jurisdictions or some homes that are working in areas where they don't have certain types of healthcare professionals, for example, or they have a shortage, for example. So this is where they might have to make sure they have a different staffing mix than, say, a home in downtown Toronto, to make sure that they can make sure that residents' needs are being appropriately met. And then that it then can be reflected in staffing ratios as well. So we give very clear definitions for how to look at those things, and those are all things that, again, that if one is being accredited, if these standards are being used as the basis of new enforcement work, it makes it really clear what we would expect that homes would be able to talk about when it comes to staffing levels, staffing ratios, and staffing mix as well.
Thank you. I appreciate the guidance about the requirements or what's recommended, and then also considering the differences across different homes and residents. So this one is also a little bit more in the nitty gritty. So maybe if you're able to answer, does the standard provide guidance to facility design or mandatory space requirements? And if so, what would be the most important aspects regarding mechanical ventilation? Not sure if you can.
No, so this is a great question. So again, the Standard Council of Canada accepted 2 proposals to work on complementary national standards. So remember, Health Standards Organization specifically focuses on, it's the only organization that exclusively does healthcare standards. But again, it looks at the care that's being provided in hospitals, in long-term care homes, in retirement homes, in home care settings, et cetera. So it looks at the care within a setting. And so if you will, the HSO standard is kind of the software. So when you take a look at a long-term care home, think about what actually happens in the home. What does that care look like? And how do we actually govern, what happens in a home? How do we operationalize that care that occurs in the home, and do that? So think of the HSO standard as a software. And then the CSA group standard that, again, has been released on December 1st, that looks at the hardware. So it looks at that physical design. It looks at kind of operational and other standards like HVAC and aspects of infection prevention and control. Where there is complementarity, both standards reference each other. So you'll see in the CSA standard, they already reference the forthcoming HSO standard, and in the HSO standard, if there's a related design or operational element that goes beyond the provision of care, then you'll see where HSO says, hey, go take a look at the complementary CSA standard so you can get the parameters around HVAC or space design and things. So both standards have been written to be kind of hand in glove and in a complementary way. So for those sorts of questions, I encourage you to go to the CSA Group Standard. It is available free for view-only access, and it's already up and on their website as of December 1st. So you can have those specific questions answered through that standard, and where there are kind of things that point to where you'll find that information. Both the CSA and HSO standard point to each other's standards, so there's no overlap, but there really is kind of a complementarity, if that's even a word, that's been created.
Great to hear it. And thanks to Emma from HSO who posted the link to the CSA standards in the chat. So encourage you to also have a look there. So this one, the next question I think you alluded to before as well, is the new standard a list of nice to haves, or are there specific quantifiable and measurable requirements that LTC facilities would have to meet, for example?
Yes, so that's an excellent question, because when you look at the CSA standard, when you look at the HSO standard, you'll see kind of two different types of kind of terminologies being used. So CSA has a very specific terminology set where they use kind of shall, should, and so on, where they basically talk about things that you must have, you have to do, or things that might be recommendations, or it's kind of, as you said, a nice to have, if you will. The HSO standard, it's kind of like, this is it, right? Like this, there's no deviation from these things. There's 111 criteria, and if a home is being accredited against those 111 criteria, there's no nice to haves. These are all the fundamental things that our technical committee said, you must be doing these things. And all of these are, again, tied to a specific accountability. They talk about what is the action, who's accountable for this, and therefore accreditors can basically say around each one, show me evidence. Like, so if you're staffing your home at 2.8 hours of direct care per day per resident, that's what you're doing, but you need to show me now, according to this criteria, that this is meeting the appropriate care needs of your residents. If you can demonstrate that, Bob's your uncle, but I think that would be hard to do. The key is that each of the criteria that are set out in the HSO standard are not nice to have. They are, this is essential to providing safe, high quality, long-term care. They're not negotiable. They are what they are, and there's clear guidance around supporting that, for example. And the goal here is, this is not a naming or shaming exercise. Like, this is kind of an opportunity for homes to really appreciate what 19,000 Canadians, what our technical committee have really said, and what the evidence says really are all the key things that need to come together to really realize safe, high quality, long-term care. And so they are, there's no nice to haves. This is what we basically say should be there. And every criteria will be one which a home could be accredited against. Each criteria is something that we recommend that jurisdictions across the country, provinces and territories that have that jurisdiction over long-term care, make sure that they are also ensuring their enforcement, their other accountability mechanisms also align with, to really enable this care that we want to provide as well.
Okay, well, good to hear. And speaking of jurisdictions, we got one about Quebec. So does Quebec accredit their own long-term care homes, and is there oversight to ensure they are following best practices developed to ensure consistency across the country?
Yes, so it's a great question. So again, right now, 68% of homes across the country are accrediting themselves against the HSO National Long-Term Care Standard. And right now, for example, 100% of homes in Quebec are accrediting themselves, or soon it'll be 100% of homes. I think right now it's 96% of homes. But right now, Quebec is the only jurisdiction that not only mandates accreditation, but also it's legislated as well. And so the Quebec government recognizes the HSO standard specifically, so homes have been in the past accredited against the old or the current, if you will, HSO standard. And as of January 31st, homes will be transitioning in Quebec to accrediting against the new standard itself. So Quebec is one of those examples where 100% of homes will be supported to accredit against the new standard. There are several other provinces or territories where 100% of their homes are either voluntarily or on a mandated basis accrediting themselves. But we certainly do have certain provinces like British Columbia, Ontario, where accreditation is both voluntary, it's not mandatory, and that there's great variation in terms of what standard homes might accredit themselves with, for example. But I suspect, and I've been really pleased to see talking with various CEOs of organizations, that they're like, we like what's happening with this HSO standard. We're going to be moving towards accrediting ourselves against the new standard, which is great because it's the only long-term care standard that's actually been developed in Canada by a Canadian organization. So it's great to see that people across Canada are having a greater vote of confidence in this, as opposed to potentially accrediting themselves against a non-Canadian developed standard of care.
Great. And I think you also addressed another question, which was about facilities who don't get accredited or not going through the accreditation process. The other, I know we're almost at time, but we'll see if we can sneak in one or two more here. You mentioned the 45 additional evidence reviews available. Would that be available to the public at some point or published in the literature? Do you know if there's any plans for that?
Yeah, I think right now, I mean, the request from HSO and the technical committee were to have what we call rapid reviews done. So they weren't written with the intent of publication at the moment, but certainly if there's an area of interest that people have, then they are welcome to connect with Emma Park, who's our project coordinator, so we can understand what a request might look like. But right now, there is no current plan to publish that. Basically anything that was drawn from the evidence review that was actually used, it appears right in the standard. So there's nothing kind of secret and left behind. If it was good and it was useful, then it was informing the guidelines, and it's right in the standard. And the standard itself has references to the key pertinent literature that was used to support the development of the guidelines and the standard itself.
Great. So I think we're at time in terms of questions, but I know Samir and Emma from HSO said that if we get additional questions, we can share them with them, and they will do their best to answer, and we can post those on our website after the webinar. So if you have a few other questions that you weren't able to get addressed today, we'll look to do that. So just wanted to again thank you so much, Dr. Sinha, for really presenting the standard, but also for addressing the many questions. I know there's a lot to unpack, and I imagine everybody on the call will be looking forward to their formal release next week, and as we will as well. I did want to also thank our audience for their excellent and engaging discussion and interest in this webinar. And again, kudos to HSO and Dr. Sinha for sharing the development of the new standard. We'll look forward to seeing that next week. So just before we go, we did want to mention that we appreciate your feedback to give us a sense if this session was helpful to you. So we would ask just for a moment, if you could take a second to complete the poll questions, which you'll see in front of you. And you'll note there's 5 questions. So if you can answer those, and our funder for question number 5, the gender specific question is a request from our funder, Health Canada, but of course it's optional to answer. Just also wanted to put in a plug. Our next webinar in this new series will be February 16th from 1 to 2 Eastern time, and we'll focus on models of care in long-term care. So we hopefully will look forward to seeing you all there. Once again, I want to say thank you to Dr. Sinha and to all of you for joining today's webinar, and really look forward to seeing you soon. Have a great day.